this is him kind of laying on his side.
Okay.
All of this, from the top to the bottom, is his stomach that is filled with food there. So all of those little particles are food particles that just isn't quite kind of going through.
Okay.
And then the little tiny, just kind of white spots there, I'm not worried about it, but that's the little Pepto-Bismol fragments. Pepto-Bismol actually shows up kind of bright white when we x-ray it. So that's kind of there. And then the thing that I am seeing is, you can kind of appreciate up here, we see the windpipe, which is the trachea going down into the lungs. The heart is kind of silhouetted here. And then I normally want to see a nice kind of black look to the lungs. And down here, all I'm seeing is fluid down in this kind of bottom part. So I'm not able to see any of the normal lung or the heart because it's outlined with some fluid buildup here. So what I don't have is a great answer for why the fluid is there. I think aspiration is most likely, given that he's a food bolter. But every once in a while I'll get a puppy that has either a congenital abnormality, some weird infection going on that's kind of unusual, just kind of things like that. So it is something that I want to stay on top of for him.
Okay, now he's always been like a loud, like, we always kind of joked like it sounded like a gremlin.
Okay,
like,
almost like,
yeah.
Okay, and that's pretty common in Frenchies, Bulldogs, and Mastiffs just because their nose is a little bit, almost, they're breaking stuff out, like breeds, the smushy face breeds. So that I don't get worried about. What I do get worried about is when I physically listen to him with a stethoscope, it sounds that way in his lungs right now because there's fluid that's taking up the normal architecture of his lungs. So right now he's just not able to move air in and out as well.
Could it have been, I had to give him a bath because he had diarrhea in his pen. Could he have caught fluid that way?
Probably not. No, I mean, he would have literally had to inhale and kind of aspirate a lot of that fluid. So I don't think so. I would think that's pretty unlikely. The most common occurrence, especially in a puppy, is something infectious. So that's why I'm putting him on just kind of a broad spectrum amoxicillin in hopes that we can kind of make it go away. For him, I want to give him a good 48 hours on the antibiotics. Really just small kind of frequent meals so we don't kind of make this any worse. If he were an adult dog where I kind of saw this amount of food, we'd make him puke it up so that we could kind of empty the stomach. I don't do that in young puppies because of the further risk of aspiration. They're just much more prone to getting that when we kind of make them puke up food. So that's why I'm not doing that for him today.
So should I just not feed him till dinner?
I want him to have till dinner, yes. I don't want him to eat anything until dinner. And tonight I want him to only eat maybe 25% of his total of normal. I mean, just enough to get him through so he has a little snack.
Like a fourth a cup of dry?
Yeah, that's all I would do.
Okay.
And you can put, I mean, I'm sure he'll eat it right away, but try and make him slow down and eat it. Maybe just feed him a few kibbles at a time to kind of force him to slow down until you're able to get something, like a puzzle bowl. And then I did all of our x-rays included in the cost. They're all reviewed by a board certified radiologist as well. So we should be getting that report hopefully tomorrow, if not Wednesday.
Okay.
Just so I always want to get, a specialist interpretation too, because that's what I know is going on, but sometimes they have other, recommendations based on what they're seeing too. So, and this kind of shows it him on his back. He didn't really want to be on his back. I don't know if he was struggling to breathe a little bit because everything kind of gets shifted when they're on their back or what, but he just didn't really want to be on his back too much. And then we still can kind of see all of the food that's building up in his stomach there. The heart is kind of what sits in this area, and then here's the kind of normal lung that I want to see, and then this kind of grayish area is the fluid, which is just kind of that white opacity there. So kind of in the bottom part of his lungs. So things I'm going to have you do at home is kind of, for one, to keep pretty close tabs on him. I really want to see the gums being a good pink color. Any gums that are white in color, I want him to get seen right away at ER overnight if it's an emergency. White gums are a quick and easy assessment that he's not moving oxygen appropriately because our gums are pink. There's a lot of red blood cells. They're carrying oxygen well. White gums, we're not moving air in and out. Those red blood cells turn white because there's not the oxygen component.
So did you take blood and see if it's
We did it today. I wanted to ask you about that. I do think we should do some baseline blood work on him and see if there's anything systemic going on.
That's fine.
It does have to get sent out, but I wanted to make sure that was okay with you before doing it. So yes, I do think that's recommended for him. And then the other thing is when you take a shower, if you make like almost like a steam, kind of
I do have a
kind of
steam
area.
shower.
Okay,
Yeah.
I'd put him in there, not directly in the water, but just enough around the steam, because sometimes we can kind of break that crud up if there's something physical in there, and then kind of hack it out. So in my really severe pneumonia cases, I actually have owners physically bang and kind of pat the chest, put them kind of around where steam is, and that kind of breaks up all that debris, and it just makes them kind of get some of that stuff out, almost like a baby that has, like a croup. You want to break it up and try and get them out. I always think that's helpful, just to kind of give them a little bit of breathing relief, and also to see if we can start getting all that fluid physically out of the lungs too.
Because this just started like in the middle of the night is when I heard this noise.
It's really weird that it's that acute. I mean, I guess it could have been brewing for a while. I find that pretty unlikely, given he sounded completely fine when we first saw him, for his puppy wellness exam.
Yeah.
So I'm glad that we at least have that to compare to. But definitely a pretty marked change today compared to when he came in for new puppy vaccines, which is why the only, I guess, new thing that I can think of is him really starting to bolt some of that food that he's got in there.
Okay.
He does have quite a lot of feces just kind of building up in the hindquarters as well. I wouldn't be surprised if he started developing more diarrhea, just because all of that food's gonna have
He's
to get
had
out too.
so much
He's had a
diarrhea.
lot.
I mean, it's been unbelievable.
Have we checked a fecal on him yet for a parasite check?
I don't think
Okay.
so.
Because all
Like my husband called me yesterday and he's like, I never seen so much come out of him.
really okay.
And then my daughter said even more came out, and my husband said, go get the Pepto. So I just gave him one little tab.
Okay.
Because I used to give it to my saint,
Yeah.
and I gave him that with a little bit of cheese,
Okay.
and he took it.
Okay.
And then I put some Pedialyte in the water
Okay.
for him to drink, because I was worried that he was getting, dehydrated. Yeah.
Yeah. And that's fine to do. I'll have some clients put like a little low sodium chicken broth in the water because it flavors it. It makes them want to eat it. Pedialyte, totally fine. I do prefer the non-flavored.
That's the one,
clear.
yeah.
That's fine to do. Because he has a ton of just feces in his GI tract, and then all of his little tiny white flecks is all the Pepto. So things are kind of moving. But I mean, if you think about one tablet that's broken up, I really would have expected it to be kind of together if things were emptying on a good timeline out of his stomach, if that kind of makes sense. And I'm just seeing it kind of all throughout his GI tract, almost like things aren't quite emptying
Slowing it down.
Okay. Yeah.
Aww,
So that's where we're at for him. So I'm out of the hospital tomorrow, but Dr. Lemus and Dr. Wensman are in. So if the lab report comes in, his X-ray report, I'll have them give you a call and make sure that there's no changes and any additional recommendations that the radiologist might have based on his X-ray report. So main things today, just make sure that he's breathing well, make sure that he's comfortable. Quick and easy assessment is looking at the gums and making sure they're a nice, light pink to dark pink color. Anything really light pink or white combined with him having difficulty breathing, that would be a red flag for me to get him seen again, because I don't want this fluid that's in there to get worse, because he's breathing well right now, but not good just because of how much fluid is in there. In the shower, steam shower, humidifier, however you can kind of just get some extra moisture in there. Our air is so dry, I really do think that a lot of moisture around is helpful. And when he's coughing, even just physically kind of banging on his sides, not super hard, not super light, just a nice, good, kind of solid. It really kind of can help break up some of the chunk and debris that's in there. Some dogs will just swallow it, so you might not see it physically coming out, but anything just to get it out of the lungs and either into the stomach or out the mouth is good.
Okay. And then maybe a little chicken broth in the water. Yeah,
chicken broth in the water, a little Pedialyte. He actually seemed pretty hydrated today. He didn't have any prolonged skin tint. He wasn't really tacky when I felt his gum, so at least based on today, he seems pretty stable. If the diarrhea continues, they're always at risk for dehydration too. So there's medications that I can give him to stop the diarrhea. I just don't want to, because I want all that food to get out. So I kind of want it to get out of his little body too. And then until we get the X-ray report and his blood work report back, we'll kind of put a pin in it until we at least get a few more answers for right now.
All right.
Okay. All right, big man. And Alethea already filled his amoxicillin. I'll just have her grab the blood work, and then we'll bring him in and we'll get you guys on your way.
Okay. All right. Thank you.
You're welcome.